Hello and welcome back to Zoology 141. Today's lecture on the cranial nerves is a continuation of the lecture we had on Chapter 13, which covered the peripheral nervous system and also the general senses. So all told, there are 12 different pairs of cranial nerves, and as the name implies, cranial nerves originate from the brain. These nerves exit the skull through holes called foramina. Remember, a foramen is just a hole, and foramina is plural for those holes. Now, the cranial nerves are named both by a name and also by a number. The numbering system starts most anterior in the brain, so that the olfactory nerve, which is the most anterior nerve, will be cranial nerve number 1. The optic nerve, which is behind that, is cranial nerve number 2, and so on and so on. Now, in addition to having numbers, of course, they do have names. And for the most part, these names oftentimes coincide with one of the functions of the nerves. For example, the vestibulocochlear nerve is a nerve which serves both the vestibular apparatus and also the cochlea of the inner ear. Now, for the most part, the cranial nerves tend to be mixed nerves. That means that these nerves carry both sensory axons, which carry information towards the CNS, and also motor axons, which is carrying information away from the CNS towards muscles and other effectors. On the other hand, we do have 3 cranial nerves which are exclusively sensory, and these include cranial nerve number 1, the olfactory nerve, cranial nerve number 2, the optic nerve, and cranial nerve number 8, the vestibulocochlear nerve. So when it comes time for an exam, you should know both the name and the number of each of the 12 cranial nerves. In addition, you should also know the major functions of each nerve. Now, your book does a good job of listing all the different functions of the cranial nerves, but that's a really long list of information to memorize. So instead, I have summarized here the very important functions of each of the 12 cranial nerves. And the ones that are in red and bold are the most important for you to memorize. Now, just like any type of anatomical structure, a good way to learn the cranial nerves and memorize their numbers is to use a mnemonic device. And the mnemonic device that they've been using in textbooks for years is this saying that's on the right-hand side of your screen. And that is, "On old Olympus' towering tops, a finely vested German viewed a hawk." And I actually know this one. I learned it when I was going to school, and somehow it stuck with me. It's not very flashy, it doesn't make much sense, but I can use it if I'm looking at the brain saying, okay, on old Olympus, number 3 is going to be oculomotor. And so it's a helpful way to remember the order of the different cranial nerves. Now, if you go online and search for cranial nerve mnemonic devices, you'll probably get some that are a lot more racy than this one and probably a lot easier to remember. And that's just great. It tends to be the more perverted sounding, the racier the mnemonic device is, the more likely it is to stick. However, unfortunately, to avoid any sexual harassment suits and just being indecent, I tend to leave those really racy mnemonics out of this lecture class. But do go online and take a look at them because they are very memorable and will help you to remember the different cranial nerves. So let's start with cranial nerve number 1. So cranial nerve number 1 is the olfactory nerve. And this is the nerve that innervates the nose and gives us our sense of smell. So the olfactory nerves really aren't that visible because these are little nervelets that are coming off the olfactory bulb. Technically, the olfactory bulb and olfactory tract are not the olfactory nerve because tracts are actually nerves that travel within the central nervous system. However, just for the sake of being easy, I am going to say that the olfactory tract and olfactory bulb are cranial nerve number 1. So remember, the main function of cranial nerve number 1 is to transmit the sense of smell to our olfactory cortex. Now, cranial nerve number 1 is one of those nerves that does not have a motor function. It just has a sensory function, and that's for smell. Now let's take a look at cranial nerve number 2, the optic nerve. As the name implies, the optic nerve receives nerve impulses from the eyes, and those optic nerves travel to the optic chiasm, and the optic chiasm, a lot of the axons from the left eye cross on over to the right brain, and a lot of the axons from the right eye cross on over to the left brain. And so this means that one side of the brain is predominantly getting visual impulses from the opposite eye. And the optic nerve is another one of those funny nerves that technically it doesn't have any motor functions. It's exclusively sensory. Now, posterior to the optic nerve, we have something called the oculomotor nerve, and that's cranial nerve number 3. If I'm using my mnemonic, I would say on old Olympus. Olympus stands for oculomotor. And oculomotor here refers to the eyes, as in oculo, and motor refers to the contraction of skeletal muscle. So the oculomotor nerve is primarily a motor nerve in that it controls some of the various muscles of the eye that control our eye movements. It also has a very slight sensory function in that it is used for proprioception of the eye. Remember that proprioception is basically knowing where your body parts are in space, even though you may not be looking at yourself in the mirror. For example, I want you to close your eyes while you're listening to me talk, and then look to the left and look to the right, look up, look down, and even though you're not looking in the mirror, you can't see your pupils, you know which way you're looking. And that's because the muscles that attach to your eye have proprioceptors and stretch receptors in them that report back to the cortex of the brain and tell you approximately which direction you're looking in. And so that's why we say that the oculomotor nerve is a mixed nerve. It contains both sensory axons and motor axons. Now, another nerve that helps to control the eye muscles is the trochlear nerve. So that's cranial nerve number 4. On old Olympus, towering. Towering stands for trochlear. So the trochlear nerve is named because if you take a look at the muscle that's at the very dorsal part of the eye, you'll see that one of those muscles goes around a piece of connective tissue that acts as a pulley. And that's what trochlea means. A trochlea is a pulley-like device. And because we're innervating a muscle that has a trochlea attached to it, we call this the trochlear nerve. And it has the same functions as the oculomotor nerve. For motor functions, it helps to move the muscle of the eye, and for our sensory functions, it receives proprioceptive signals from those eye muscles, so we know which direction we're looking in. So cranial nerve number 5, however, is the trigeminal nerve. Think about on old Olympus towering tops. Tops here stands for trigeminal. And trigeminal is a nerve that splits into 3 different branches, as the name tri implies. And so we have an ophthalmic branch, a maxillary branch, and a mandibular branch. And this is a very evenly mixed nerve in that we have sensory functions, but we also have motor functions. And the sensory functions include our sense of touch, a sense of nociception within the face and the mouth, sense of temperature, and also proprioception. The motor functions here have to do with innervating the muscles of mastication, that is, our chewing muscles. So our trigeminal nerve is important for the muscles of mastication. Okay, this slide just shows the different branches of the trigeminal. Up top we have the ophthalmic branch, which goes to the superior and inferior parts of the orbit. We have the maxillary branch, which goes to the upper jaw. And finally the mandibular branch, which goes to the lower jaw, innervating the muscles of mastication. Now we come to cranial nerve number 6, which is the abducens nerve. If you're counting backwards using your mnemonic, you'd say on old Olympus towering tops A. A stands for abducens. And so the abducens nerve is finally another nerve that helps to innervate the muscles of the eye. So just like the oculomotor nerve and also the trochlear nerve, the abducens nerve controls the muscles that control the eyes, and it also receives sensory input from those muscles that are used for proprioception. So in summary, you should know that 3 different cranial nerves control the movements of the eye muscles, and these include cranial nerve number 3, the oculomotor nerve, cranial nerve number 4, the trochlear nerve, and cranial nerve number 6, the abducens nerve. Okay, our next nerve is the facial nerve. If you're using the mnemonic, that would be on old Olympus towering tops A finely. So finely would be standing in for facial. So the facial nerve is cranial nerve number 7. It has primarily a sensory function, but also has a motor function as well. So the sensory functions here is that it helps to sense our sense of taste on the anterior 2/3 of the tongue. It's also important for proprioception of the tongue, that is, moving your tongue from side to side and knowing where it's going. The other functions are motor functions. The facial nerve innervates the muscles that give us facial expression. For example, the buccinator, which helps us to purse our cheeks, or the zygomaticus, which helps this little baby here to smile. The other types of effectors that the facial nerve innervates are the salivary glands and also the lacrimal glands. And so when we have lacrimation, we form tears, and we have salivation, we form saliva. And these are formed primarily through an autonomic reflex, which we'll talk about in the next chapter. Okay, this picture just shows the fact that the facial nerve actually does branch off into 3 large branches. One of those branches goes to innervate the salivary glands and the bottom of the mouth. The middle branch goes to innervate the tongue, where it gives us a sense of taste or gustation, and it innervates the anterior 2/3 of the tongue. And finally, the last branch innervates the muscles of facial expression that help us to smile, to frown, and so on. So remember that the facial nerve is both sensory and also motor. Sensory in that it gives us our sense of taste, and motor in that it controls our salivary glands and also the muscles of facial expression. Okay, while we're on the subject of the facial nerve, we should talk about a condition which sometimes affects the facial nerve called Bell's palsy. Now, Bell's palsy is a condition which causes the paralysis of the facial muscles on one side of the face. It can also cause a loss of sensation in that skin on the same side of the face and a loss of taste in that area of the mouth. And so Bell's palsy is a condition that can occur very abruptly. Oftentimes it occurs overnight, sometimes as a result of a herpes virus. Sometimes it can be caused through trauma, let's say during dental procedures, and sometimes it occurs just idiopathically, which basically means we don't know why it happens. Even scarier is that sometimes it can be a temporary condition that resolves itself and goes away, and sometimes it's here to stay. So there's a lot of uncertainty built in with somebody with Bell's palsy. Basically, you can wait it out, see what happens, but we can't really guarantee whether or not you're going to recover from it. Okay, now we're on cranial nerve number 8, which is the vestibulocochlear nerve. Go back to your mnemonic device. On old Olympus towering tops a finely vested. Vested stands in for vestibulocochlear nerve. And so this is one of those exclusively sensory nerves in that it gets sensory information from 2 different branches. One of these branches is called the cochlear branch, and the other one is called the vestibular branch. Now, you're probably already aware that the cochlea is an area of the inner ear, and this is the area where we transduce sound or convert sound into action potentials, which are then going to travel to the temporal lobe of our brain where sound is processed. On the other hand, the vestibular branch processes information from the vestibular organs, that is the semicircular canals, and also the otolithic organs that are located adjacent to the cochlea, and these help us to sense dynamic and static equilibrium. And so things like acceleration and deceleration are transmitted through the vestibular branch of the vestibular cochlear nerve, as are orientation. When you turn right side up, upside down, you're aware of your orientation to gravity, and that's because of the otolithic organs that are in our vestibular region. And so those nerve impulses travel through the vestibular branch back to basically the vestibular cortex. Now, if we have any type of disorder that affects, let's say, our vestibular organs, our semicircular canals, or that affects this nerve, we can get something called ataxia. And ataxia just means that you're stumbling around. Think about somebody that's drunk and stumbling around. They would be demonstrating ataxia. Another thing that can be caused is something called vertigo, where you're just very, very dizzy. You feel like you're spinning around even though you're standing stock still. And so vertigo can be just very life-altering. There's certain diseases that affect the inner ear and the nerves that come out of the inner ear. For example, Meniere's disease is one that we'll learn about in the next chapter that causes a very severe type of vertigo and sometimes ataxia. Okay, our next cranial nerve is cranial nerve number 9, the glossopharyngeal nerve. Now, glossopharyngeal has 2 parts here, glosso, which means tongue, and pharyngeal, which means pharynx. And so this is a mixed nerve that has both motor and sensory functions. The sensory functions is that it helps us to sense our sense of taste on the posterior 1/3 of the tongue. It also has proprioceptors which are monitoring the relative position of our swallowing muscles to one another. As far as motor functions, it helps to elevate the pharynx during swallowing, and it also stimulates salivation through an autonomic reflex. Again, this photo just shows a diagram of the different structures in the face that are innervated by cranial nerve number 9, the glossopharyngeal nerve. So again, they include things like the parotid salivary gland. So this would be innervated by some of the motor axons that control salivation. Also innervated by the glossopharyngeal nerve is the posterior 1/3 of the tongue. And again, this part of the nerve is going to be carrying sensory axons, which are carrying action potentials away from the taste buds on the back of our tongue. So this is a nerve that helps us to taste. Okay, and here we are at cranial nerve number 10, which is the vagus nerve. Now, the vagus nerve is a very, very, very important nerve. It's the most important nerve in the autonomic nervous system because 90% of our parasympathetic axons travel via the vagus nerve. And the term vagus here means wanderer, which is very important because so far we've looked at cranial nerves that come off of the brain, exit the skull, and then go to very nearby structures. Maybe the neck, maybe the head. Basically, they're hanging around in the area of the neck and the head. The vagus here is an exception. It's the wanderer because the vagus nerve innervates organs that are in the thoracic cavity, it innervates organs in the abdominal cavity, all over the body. And so that's why we call it the wanderer. And so the vagus nerve has lots of sensory and also motor functions. Just like some of the other nerves we looked at, it helps to transmit taste and somatic sensations from the mouth and epiglottis. It also helps to monitor oxygen and carbon dioxide and blood pressure. And again, these are types of sensations that we're not consciously aware of, but are reported back to the areas of our brain, for example, the hypothalamus. The other thing that it does is get visceral sensations from the thorax and the abdomen. So think about the organs like the intestines, the esophagus. All of them are innervated by the vagus nerve. As far as motor functions go, the vagus nerve is somewhat important in swallowing and coughing, as well as stimulating some of the GI secretions. It tends to stimulate mucus production when we have a lot of parasympathetic nerve impulses. And it also tends to reduce the heart rate. The heart has a very strong vagal tone, which means that it responds to stimulation by the vagus nerve. So normally the heart rate would be pretty high if we didn't have the vagus nerve. For example, if I've got somebody hooked up to a heart-lung machine and all of a sudden I cut the vagus nerve, you'll notice the heart rate will go from somewhere around 60 to 70 beats to a minute up to 100 beats to a minute. And that's because the vagus nerve, when it's connected to the heart, has a calming influence. It tends to reduce the heart rate and also reduce the magnitude of contraction. So here's another slide showing all the different structures in the body that are innervated by the vagus nerve. Remember, vagus here means wanderer, and that is a very apt term because look at all the different organs that are connected to the vagus nerve. The vagus nerve innervates the heart, it innervates the lungs, it innervates the esophagus, the liver and the gallbladder, the stomach, the large intestine, small intestine, the pancreas. So all of these have both sensory and motor axons that are traveling to these areas. And what this means is that if I stimulate one of these organs, I can have an effect on another organ in the loop. For example, let's take a look at the large intestine. Let's say that you are a nurse or a nurse's assistant and you've been tasked with giving Mrs. Jones her daily enema. Now, you're giving her an enema because she's having a problem with defecation. So you have her lay down, you take the lubricated tip of that enema and insert it into her anus, and all of a sudden Mrs. Jones passes out. Her blood pressure plummets, and you're worried as hell. Now, what we've just described here is a process called vasovagal syncope, and this is a part where somebody may pass out or at least their blood pressure may decline as a result of stimulating an organ that is innervated by the vagus nerve. So in placing the nozzle for that enema up that patient's rectum, you inadvertently stimulated the large intestine. And because the large intestine is innervated by the vagus nerve, it can sometimes result in an abrupt parasympathetic stimulation of the heart. And remember, the main function that the vagus nerve has on the heart is to reduce the heart rate. If the heart rate is already normal, let's say 60 or 70, and we reduce it to 50 or 40, that can reduce the blood pressure and cause the person to pass out and even sometimes go into cardiac arrest. So please take a minute and look up vasovagal syncope and vasovagal tone. Okay, our next nerve is cranial nerve number 11, which is our accessory nerve. Again, if you're going to count this down using our mnemonic device, we would say, on old Olympus towering tops, a finely vested German viewed A, and so A stands here for accessory nerve. And this is one of the nerves that is named a cranial nerve, but people are starting to look at now and say, is it really a cranial nerve? It seems to originate more from the spinal cord in the lower part of the medulla, but we're going to go ahead and keep calling it a cranial nerve because we've been calling it that way for probably over 150 years. And so just like most of the nerves in the cranial nerves, this is a mixed nerve. The sensory functions here primarily a little bit of proprioception of the larynx and pharynx, so knowing where those parts are by sensation, but the motor functions here are much more important. So the accessory nerve is important in swallowing. It's also important in the movements of the head and shoulders. In particular, the motor branches of the accessory nerve innervate the sternocleidomastoid muscle, which again helped us to flex the neck and also do a little bit of rotation and lateral flexion. And the other muscle that innervates is the trapezius muscle. Remember, the trapezius was a muscle that we used to extend the neck and also to hyperextend it. It's also a muscle we use to elevate the scapulae. Okay, and finally our last cranial nerve is cranial nerve number 12, the hypoglossal nerve. Hypo here means below, and glossal, remember, means tongue. And so this is another mixed nerve, but primarily has motor functions. It helps us to move the tongue for speech and also for swallowing. At the same time, it still has a little bit of proprioceptive function. We're able to move our tongue around in our mouth and know which direction our tongue is pointing in. Can you think of any celebrities that might need a little bit more control of their hypoglossal nerve? You've now reached the end of this very short lecture on the cranial nerves. Like normal, there will be a few questions at the end of the presentation so you can quiz your knowledge about the cranial nerves. Now, you won't be graded on these questions, but if you get less than 70%, I do suggest you go back and re-watch the lecture again, take detailed notes before you go on to take this week's La Lima quiz.